burdens of thalassemia, diabetes, and hypertension. From the Philippines, a pioneering effort to improve newborn and maternal health across the Western Pacific region. From China, a new model of health promotion for older people designed to improve health literacy. From Lebanon, outstanding leadership in taking a holistic approach to healthy aging. From Guatemala, decades of dedication to improving patient care through a community-centered approach to health. And from Bahrain, a lifelong commitment to leadership in health promotion and primary health care. I congratulate each of the laureates for their inspirational contributions to health and well-being. And I thank the foundations and institutions who so generously support these awards. At a time when the world faces many challenges, each of you is an inspiration and a reminder of the progress that can be made to improve health and well-being for all. I salute you all, and I thank you. And back to you, President.
Thank you, Dr. Tedros. It is now my pleasure to announce that the 2023 Sasakawa Health Prize has been awarded jointly to the Nick Simmons Institute of Nepal, represented by Dr. Arkana Amatia, and Professor Vishai Tienthavorn of Thailand. I invite Mr. Yohei Sasakawa, Chairman of the Nippon Foundation and WHO Goodwill Ambassador for Leprosy, to address the Assembly on behalf of the Sasakawa Health Foundation. Sir, the floor is yours.
It is my great pleasure to extend my heartfelt congratulations to the recipients of the 39th Sasakawa Health Prize. I'd also like to express my gratitude to Director General Dr. Tedros Adhanom, the selection panel, and all who have made this award ceremony possible. The Declaration of Alma Ata of 1978 stipulates health as one of the basic human rights, and that promotion of primary health care is the key to achieving health for all. My late father, Ryoichi Sasakawa, immediately took action and established the Sasakawa Health Prize to commend individuals and institutions for their notable contribution to the promotion of primary health care. This year, Sasakawa Health Prize Award goes to Professor Vijay Tienthavorn and Nick Simons Institute from Thailand and Nepal, respectively. Professor Vijay Tienthavorn is well known for his study and treatment of thalassemia and for the prevention and control of diabetes and hypertension. He has also made outstanding contributions to the establishment of a local medical system in Thailand, including the development of training programs for medical professionals and a local health workforce. Nick Simons Institute, whose mission is to enhance rural healthcare in Nepal through innovative medical services and solutions to health problems. These goals are fortified a range of enabling tools such as minimum service standard or MSS necessary for the self-evaluation of local hospital management, electronic medical record system or EMRs for the enhancement of rural medical service and patient health care, and training and education of competent healthcare workers. I now present this prize with my deep respect to the outstanding work of both recipients and my desire they will be continue to work as pioneers in further advancement of primary health care. Once again, congratulations.
Thank you. It is now my privilege to present this prize to the Nick Symmonds Institute. I would now like to invite Dr. Akana Amatya to address the Assembly on behalf of the Nick Symmonds Institute. Just going for now.
Good morning, respected dignitaries on the dais, representatives of the WHO member states, ladies and gentlemen. A very good good morning and namaste from Nepal. I bring greetings from the Nick Symmonds Institute, where as an executive director, today I feel very humbled and honored at the same time to receive this prestigious Sasakawa Health Prize. I would like to thank the WHO, the selection panel, the Sasakawa Foundation, and my Ministry of Health and Population for conferring this prestigious award upon us. And because this is the first time for Nepal, this makes it even more important for the country to move forward and get motivated. And at this point of time, I would also like to appreciate the hard work of my colleagues out there at home and their efforts, which has led the organization to such heights today. And at the same time, my sincere appreciation to our patrons, Jim and Marilyn Symmonds at the United States. This award has definitely strengthened Nick Symmonds Institute to resolve to continue working in rural health care with the Ministry of Health and Population in Nepal. And Nick Symmonds Institute works with innovative solutions to improve rural health care by training health cadres, by developing curative service systems within the hospitals, hospital strengthening systems in various ways, and at the same time, advocating for good practices. Once again, please accept my heartfelt gratitude on this prestigious award, and I personally think that this award really motivates us to do better in the days to come. Thank you very much, ladies and gentlemen, and I wish you a very good day.
Thank you. It is now my pleasure to present the prize to Professor Vishai Tienthavorn. Please come to the podium. I now invite Professor Vishay Tienthavorn to address the Assembly.
Good morning, Honorary President, board members, the member state of the WHO Executive Board, ladies and gentlemen. This is a very auspicious moment in my life. I would especially like to thank the Japanese Shipbuilding Industry Foundation and the Sasakawa Memorial Health Foundation for the initiative and the award. พระบรมราชนก Institute of PBRI bear the name of the Prime Prince Mahidol, the father of the modern medicine, public health in Thailand. PBRI, which I am the president, produce nurse 4,000 nurses, annually, which is the highest number in the world. The award is not only for myself, but also the high social recognition for the PBRI. Selecting the right partner, the right pregnancy, and the right delivery. As I used to promote the prevention of the genetic inheritance of the thalassemia, we always definitely improve in MCH and primary planning program. The modified traffic light communication tool, 7-color ping pong for controlling NCD, is also another initiative that provides a simplified version of NCD, helping healthcare workers and health volunteers to communicate with the patient and empowering individual patients to be able to improve their own health. Primary health care is always my concern and become a significant policy of PBRI. We offer health and allied public health program training to students for the rural areas, especially that who are marginalized, for rural focused primary care facility in Thailand. I would like to ensure that my never-ending effort to improve primary health care for healthy family and SDG goal. Once again, thank you on the selection committee, the exceptional continuous support from the past and current ministers, doctor, nurse, health volunteer, as well as my family's normal support and inspiration. They are really my backbone. Thank you very much.
Thank you. It is now my pleasure to announce that the 2023 United Arab Emirates Health Foundation Prize has been awarded to Dr. Maria Silvestre of the Philippines. I invite Dr. Hussein Abdul Rahman Arand, Assistant Under Secretary for Public Health Sector, Ministry of Health and Prevention of the United Arab Emirates, to address the Assembly on behalf of the United Arab Emirates Health Foundation. Dr. Arand, please, you have the floor.
بسم الله الرحمن الرحيم. معالي كريس فيرون رئيس الجمعية.
Thank you very much, President of this World Health Assembly, Dr. Tedros, DG, honorable ministers, distinguished members of delegations. May the peace and blessings of God be upon you. On behalf of the UAE, I have the honor of greeting you and welcoming you to this wonderful and august body, which is celebrating different personalities who have helped to bolster treatment and health. Our foundation tries to bolster the WHO's role, its pioneer role in protecting human health. I would take this opportunity to thank the members of the EB and the Secretariat for their efforts to pay tribute to the different laureates. The prize of the UAE tries to motivate workers in the health sector, researchers, specialists, all who contribute to health, human health in different sectors of public health. And this in close cooperation with the United Nations in a general fashion and the WHO specifically in its elaboration of projects which strengthen health for all. I am honored to announce that the prize of the UAE Health Foundation Prize 2023 was awarded to Dr. Maria Asuncion Silvestre of the Philippines. She is a specialist of mother, child, and infant health, specifically with regard to maternal infant health. She has developed a number of health procedures for women during the birthing process and for infants after birth and the child's first week of life. She also worked indefatigably to contribute to numerous technical groups, both at a regional and international level, to make progress in primary health care services. The United Arab Emirates, supporting this prize, will continue to attach importance and support to researchers, those working in science, to ensure more effectiveness in the fight against different diseases and to address health challenges. It is a pleasure for me to bestow this prize upon the doctor, and I would reaffirm the commitment of the UAE to address all health challenges. I thank you very much for your kind attention.
Thank you, Dr. Arad. It is now my pleasure to present this prize to Dr. Maria Asuncion Silvestre. I now invite Dr. Maria Asuncion Silvestre to address the Assembly.
Good morning. Thank you, Director General Tedros, the President of the World Health Assembly, Your Excellencies, my deepest gratitude to the Philippines Department of Health, the United Arab Emirates Health Foundation Selection Panel, and the WHO Executive Board. I am all at once now honored but humbled, intimidated a bit, but emboldened, and proud and proud of the collaborative and collective work of our multisectoral team, Unang Yakap, which means the first embrace, and the WHO Western Pacific regional staff. Work that might be considered innovative, but in reality is built on the work of many and our very own Dr. Natividad Clavano. Edmund in 2006, and later Mulaney in prospective cohorts of breastfeeding newborns in Ghana and Nepal demonstrated compelling evidence that the longer the first breastfeed is delayed, a 2 to 4-fold risk of a rise in the risk of dying from infection occurs in newborns. We follow the evidence to policy, to practice mantra, and we had to provide our own evidence. in Philippine hospitals, immediate newborn care practices, for example, routine suctioning and early bathing, were preempting this first breastfeed. So we sought to re-choreograph actions in the first minutes to hours after birth, eliminating these unnecessary actions, intertwining interventions for the mother and her newborn. We formulated a time-bound sequence of steps, starting with immediate and thorough drying, with early skin-to-skin contact, delayed cord clamping, and most importantly, non-separation of the mother-newborn dyad. Many countries have implemented and reaped the benefits. In 2020, Bryce and Mulaney again reported that the more the essential elements or steps received, newborn survival does improve. Breastfeeding saves lives, and it is the foundation of health. We should send out clear, consistent, and resounding messages devoid of commercial interests. Non-separated, the mother-newborn dyad is our first food system. We should protect it as passionately and as fiercely as we protect our agricultural lands, our coral reefs, and our rainforests. Mabuhay.
Thank you very much, and congratulations once more. It is now my pleasure to announce that the 2023 His Highness Sheikh Sabah Al Ahmad Al Jabbar Al Sabah Prize for the Research in Healthcare for the Elderly and in Health Promotion of the State of Kuwait Health Promotion Foundation has been awarded jointly to the National Center for Chronic and Non-Communicable Disease Control and Prevention of China, represented by Professor Yingwu, and to Dr. Alba Mejia Sabai of Lebanon. I invite Dr. Al Ahmed Al Alawi, Minister of Health of the State of Kuwait, to address the Assembly on behalf of the State of Kuwait Health Promotion Foundation. Excellency, you have the floor.
Good morning, bonjour, and sabah al-khair. Bismillah ar-Rahman.
In the name of God, the most gracious, the most merciful, may the peace and blessings of God be upon you. Your Excellency, the President of the 76th of the session of the World Health Assembly, Dr. Christopher Fern, Minister of Health of Malta, Your Excellency, Dr. Tedros, Director General of the WHO, Excellencies, Ministers and Heads of Delegations, brothers and sisters, honorable participants, peace and God's mercy and blessings be upon you. It is my pleasure and honor to meet you today at the World Health Organization on the sidelines of the 76th World Health Assembly at this award ceremony of His Highness Sheikh Sabah Al Hamad Al Jabbar Al Sabah Prize for Research in Healthcare for the Elderly and in Health Promotion for 2023. In fact, this prize reflects the status accorded to the elderly as a major development priority in health programs, as well as the attention, care, gratitude, and recognition they deserve in acknowledgement of their generous contributions throughout their lives. I must also, on this special occasion, extend my heartfelt and sincere congratulations to His Excellency Christopher Fern, Minister of Health of the Republic of Malta, on his election as President of this session of the World Health Assembly. I would like to also express my appreciation to the outgoing President of the 75th World Health Assembly for the achievements made to promote international solidarity in various health fields. This prize and its laureates for 2023 that we celebrate today constitute a shining example and positive initiative on the path to the constructive cooperation between the states of Kuwait and the WHO, which dates back to more than 6 decades ago, i.e. since the state of Kuwait became member of the WHO in 1960. I am pleased to participate in this ceremony as representative of the state of Kuwait. May God the Almighty rest the soul of the sponsor of this prize in peace and grant him mercy and forgiveness and reward him for his good deeds. I would like to extend my heartfelt congratulations as well to the winners of the prize for 2023, namely Dr. Mejia Sabai from the American University of Beirut, Faculty of Sciences, Republic of Lebanon, and Dr. Jong-wook, Director of the National Center for Chronic and Non-Communicable Disease Control and Prevention from the People's Republic of China, for their outstanding achievements in improving care for the elderly. I wish them further progress and success in their endeavors in paying tribute to the elderly and in furtherance of their legitimate rights to health care. I hope that this award will serve as an incentive for more innovation and contributions to promote global solidarity to safeguard the rights of the elderly to health care. I would like to also take this opportunity to express my sincere thanks to the staff of the WHO under the wise leadership of Dr. Tedros, the Director General, for their efforts and support to the prize throughout its various stages as part of the WHO high-impact programs and initiatives. Brothers and sisters, honorable attendees, I thank you for your participation and your kind attention. And thank you for taking part in the ceremony. May God the Almighty help us achieve our desired goals and targets and achieve health for all in a spirit of joint action and solidarity to achieve the Sustainable Development Goals. Thank you very much for your kind attention. Peace and blessings of God be upon you.
Thank you, Excellency. It is now my privilege to present this prize to the National Center for Chronic and Non-Communicable Disease Control and Prevention of China. I now invite Professor Jin Guan to address the Assembly on behalf of the National Center for Chronic and Non-Communicable Disease Control and Prevention of China.
President, Director General, Ministers, guests, and friends. We are very grateful to the State of Kuwait Health Promotion Fund and the Selection Committee for granting us this honor. This is not only a recognition of China's efforts in elderly health care and health promotion, but also a new driving force for the construction of a global community of health for all. Chinese often say filial piety is the most important of all virtues, and respecting and loving the elderly has always been a traditional virtue of the Chinese people. Putting people first and life first, the Chinese government has attached great importance to elderly health, implemented the Healthy Aging Strategy and Healthy China Strategy, and integrated the concept of healthy aging into the entire process of socioeconomic development. As a national professional and technical institution for chronic disease prevention and control and elderly health promotion, my center's main responsibility is disease control, scientific research, and education and training. Along with our colleagues around the country, we carried out a series of elderly health programs such as National Health Literacy Survey and Promotion Actions, Psychological Care Program, and Prevention of Dementia and Disabilities to improve the health status, sense of gain, and happiness of the elderly. Once again, I would like to express my heartfelt thanks to the National Health Commission, the CDC, and our friends in and out of China for your support and care. We will also take this award as an opportunity to share more Chinese experience and wisdom, work closely with global partners, and make more contributions to this cause, a cause full of love and warmth. Respect for the elderly is
Respect is not only expressed in words, but also in practice. Let's work harder, hand in hand. Thank you. Merci.
Thank you very much. It is now my privilege to present this prize to Dr. Alba Mejia Sabai. I invite Dr. Alba Mejia Sabai to address the Assembly.
Good morning, Your Excellencies, Member State representatives, esteemed guests. I'm deeply honored and humbled to be the recipient of this prestigious award. I'm also very grateful to my nominator, Dr. Firas Al-Abyad, the Minister of Public Health in Lebanon, and to the World Health Organization, and to the State of Kuwait Health Promotion Prize Selection Committee for this esteemed recognition. I consider myself very fortunate to be working at an outstanding institution like the American University of Beirut back home in Lebanon. And I'm very thankful for the support of many wonderful colleagues, talented collaborators, and inspiring students. This prize belongs to all of them. One of my proudest accomplishments is the founding of the University for Seniors program, Jamiat Al-Kibar, an innovative and unique late life learning initiative in Lebanon and the Arab region. It provides older adults with opportunities to learn new things, to remain intellectually engaged, physically active, and socially connected. The program prioritizes health promotion and wellness over healthcare, and this is in alignment with WHO frameworks for successful and healthy aging. This award, in fact, comes at a very critical time for Lebanon, my home country, a country facing one of the most severe economic crises in modern times. The crisis has hit all of us, but in fact, it has hit our older population the most, the hardest. And it remains our duty as public health professionals to strive for the rights to social protection, to health and social care, and self-realization. The prize puts on me greater responsibility to continue work in making the world a safer, more just, and dignified place for our seniors, for our older adults, and for all of us. This prize is a tribute to all those who share this vision. Thank you, wa shukran.
Thank you and congratulations once more. It is now my pleasure to announce that the 2023 Dr. Jong-wook Memorial Prize for Public Health has been awarded to Dr. Jorge Francisco Meneses of Guatemala. I now invite Dr. Myung-Dono, board member of the Korea Foundation for International Healthcare, to address the Assembly on behalf of the Dr. Lee Jong-wook Memorial Fund. Sir, you have the floor.
Honorable President, His Excellency Dr. Tedros Adhanom Ghebreyesus, the Director General of WHO, distinguished delegate, and ladies and gentlemen, my name is Oh Myung-don, and I am a board member of Korea Foundation of International Healthcare, KOFI. It is with great honor that I attend the 76th World Health Assembly to award the Dr. Lee Jong-wook Memorial Prize for Public Health to honor the legacy of Dr. Lee, the late 6th Director General of WHO. KOFI has promoted healthcare cooperation globally, thereby committing to reducing health inequality worldwide. As part of this effort, the Memorial Prize was established to uphold Dr. Lee's core value of promoting public health. By doing so, KOFI endeavors to create a healthier world and to strengthen long-term public health around the world. I am therefore greatly pleased to announce that this year the prize goes to Dr. Jorge Francisco Meneses from Guatemala. Dr. Meneses has been dedicated to improving public health for decades. One of the many contributions he has made is the ethical and patient-centered care model that has been scaled up and implemented at the national level. Moreover, his work has led to Guatemala adopting a national strategy of integrated health service networks, thus making Guatemala stand out as the only country in Central America to be using such an innovative strategy. Considering his incredible dedication, I am pleased to extend my sincere gratitude and warmest congratulations to Dr. Meneses on behalf of everyone here today. In particular, this year is very meaningful because the guideline for the Memorial Prize was reinforced. As it has always been, we aspire to present the Memorial Prize to encourage and inspire those who work diligently for public health around the world and set an example for others. KOFI will continue to promote public health throughout the world with the Ministry of Health and Welfare of the Republic of Korea and be a reliable and trustworthy partner to the WHO and global health community. Thank you very much. 감사합니다.
Thank you. It is now my privilege to present this prize to Dr. Jorge Francisco Meneses. I now invite Dr. Jorge Francisco Meneses to address this assembly.
A very good morning, ladies and gentlemen, distinguished representatives of the member states of the World Health Organization attending this assembly, distinguished Director General of the World Health Organization, distinguished President of the Assembly, distinguished prize winners of the 2023 Public Health Awards, a very warm greeting. My name is Jorge Francisco Meneses. I am a community health physician and I come from the Republic of Guatemala. For me, it is a great honor to be present at this World Health Assembly, and I feel very honored to receive this Dr. Lee Jong-wook Memorial Prize for Public Health. I am very humbled by this award. I should like to thank the WHO Selection Committee for having chosen me to receive this prize. I should also like to extend my thanks to the Public Health and Social Welfare Ministry of Guatemala for having nominated me, and the Korea Foundation for International Healthcare, which instituted the Dr. Lee Jong-wook Memorial Prize for Public Health. I am absolutely convinced that integrated health service networks based on primary health care constitute the strategy which will enable my country, Guatemala, to make substantial changes to its health system, promoting equity of care and getting rid of the segmentation and fragmentation which currently mar the system. For this reason, I am willing to continue to provide advice and technical support to the Ministry of Health on the implementation of integrated healthcare service networks, and particularly to do that in the poor rural areas of Guatemala where people have been uprooted from their land. This will help us to bring health services closer to them and ensure that all those people who for the moment do not have access to health care can benefit from continuity of care. Thank you.
Thank you, and congratulations once again. It is now my pleasure to announce that the 2023 Nelson Mandela Award for Health Promotion has been awarded to Dr. Mariam Adhbi Al-Jahalama of Bahrain. I invite His Excellency Mr. Shoisi Nkosi, Ambassador Permanent Representative of South Africa to the United Nations Office at Geneva, to address the Assembly. Excellency, you have the floor.
Thank you. Mr. President of the 75th session of the World Health Assembly, Your Excellencies, Ministers, Your Excellency, Director General, distinguished laureates of the 2023 WHO Awards, esteemed representatives of foundations, ladies and gentlemen. South Africa is extremely honored to participate in the Nelson Mandela Award for Health Promotion ceremony this morning as a tribute to Madiba and South Africa's unflinching commitment to the World Health Organization's goal of ensuring universal health coverage, protecting people from health emergencies, and providing people with better health and well-being we have consistently participated in the Nelson Mandela Award for Health Promotion ceremony since its launch in 2019. I take this opportunity to express our most sincere appreciation to the Director General, Dr. Tedros, for his vision in conceptualizing this award. The award recognizes the outstanding contributions of individuals and/or entities to public health development. South Africa is grateful that this prestigious award is named after the global icon who is a symbol of compassion, humility, and service to humanity. It is indeed fitting that the award recognizes the accomplishment of individuals whose work gives concrete expression to the goal of quality health care to every citizen. In this regard, I'm extremely honored to present and indeed to congratulate the laureate of the 5th edition of the Nelson Mandela Award for Health Promotion, Dr. Mariam Adhbi Al-Jalam of Bahrain, for her extraordinary contribution to the promotion of health for all. We note with admiration that the work of Dr. Al-Jalam contributes to health and the improvement of the quality of life, thus restoring dignity to humanity, particularly people living with HIV/AIDS, those who were on drugs, as well as those whose health was compromised by the COVID-19 pandemic. As President Mandela said, and I quote, "What counts in life is not the mere fact that we have lived. It is what difference we've made to the lives of others that will determine the significance of the life we lead." Close quote. Dr. Al-Jalam's contribution to humanity and her agency is a fitting example of what President Mandela meant. May this award continue to inspire her work and that of others who want to contribute to ensuring health for all and promote the social equity ideals that Nelson Mandela stood for. Once again, congratulations to Dr. Al-Jalam. I thank you, Mr. President.
Thank you, Excellency. I now have the privilege to present this prize to Dr. Mariam Adhbi Al-Jalama.
Thank you very much.
I now invite Dr. Mariam Adhbi Al-Jalama to address this assembly. Dr. Al-Jalama, you have the floor.
Thank you. Dr. Tedros Ghebreyesus, the Director General of the World Health Organization, President of the 76th World Health Assembly, honorable delegates, I wish to start my speech by thanking the Nelson Mandela Award Selection Panel for selecting me for this award. It's an absolute honor to be standing before you all today as the recipient of this esteemed award for health promotion. My gratitude goes to my country, the Kingdom of Bahrain, its leadership, and my family for their continuous support and for recognizing and appreciating my work and efforts. I want to dedicate this award to all healthcare workers in my country and all over the world who dedicated their lives to ensuring that people live healthy lives. This award is not just a recognition of our hard work, but also a testament to our dedication and passion for making a positive impact on the world. For 37 years of working in the healthcare sector, whether as a family physician, manager, leader, or during my voluntary work in the society, health promotion has always been at the heart of my work, and I must say that it has been a rewarding experience. I conclude by urging everyone to continue working towards promoting health and well-being in their communities. We have the power to make a difference, and we should not shy away from taking action to improve the health outcomes of our people. Thank you very much.
Thank you, and once more, congratulations. Before we conclude this agenda item, please allow me to thank the Executive Board for its leadership in this important process, amongst, of course, the many other duties. This concludes, therefore, the consideration of item 7 of our agenda. However, I would now kindly invite the Director General, the laureates, and the Foundation representatives for the prizes and awards given today to join me outside of this room for a short photo opportunity of this memorable occasion. During this time, I invite our distinguished guests and delegates to remain seated as we will proceed to item 6 of our agenda immediately after this very short pause. Thank you very much.